All right, it's a beautiful day we have today. I'm really excited about our show today because somebody that I've been chasing for quite a long time is here to talk to us. Oral health, general health has been something we Christians and Adventists, I must say, are very much keen on, and as such, we need to take a critical look at it. So we're able to, as Christians, take care of our health very well. And today I'm pleased to have Dr. Patience Monday here. Dr. Monday is the technical advisor to the Shupo Dental Unit in Kumasi. And glory be to God, she's here at the studios with us to talk about our dental care. I guess I got your name right, Patience.
Yes, you did.
All right. So is it the Monday? Kindly mention it again to us so that we're able to pronounce it well, because I'm much keen about names.
Okay, so the Monday, it's actually supposed to be Mond, French.
Oh, okay.
For world.
Oh, okay.
But since I was young, like from primary, I just ended up adjusting to the Monday than to explain to people like, why do you have a French surname? So right. Now it's just Monday.
Oh, okay. I get it now. So it's Mond.
Yes.
So we will say Monday, whichever way. I know it's accepted.
Mm-hmm.
So how is Shopo?
Shopo, it's a very small and growing dental unit. We started last year in September, so we are still new, but things are moving very well right now.
Okay, we thank God for that. Yes. Today we are talking about dental care, and you being a dentist, maybe I forgot to add, Dr. Monday is a dentist. So I think quite a few days ago, she was inducted here in Ghana. So she's our very own dentist here. Now, take it from somebody who doesn't know anything about dentistry. Just the word dental care, dental oral care. I want to know, what is dental oral care in general sense?
Okay, so dental, it's coming from the word dentition, which is the teeth in our mouth. So that's where we get the word dental. So when you talk about care, is how you take care of something. So dental care or oral care, mainly we are just going to be discussing about how you have to take care of the well-being of your teeth or of your mouth in general.
Oh, okay. Can you explain the connection between oral health and general health? Yeah.
Okay. So most of us, they think like the mouth is separate from the rest of the body, but actually they're wrong. So oral health generally affects the well-being of the whole body, because from the food that we eat, it starts from the mouth to be digested and then it goes down. If you drink water, it starts from the mouth. If you are talking, the air is the mouth. So sometimes people always don't really want to take care of their mouth, or they don't go for dental checkups because they think it's irrelevant. But in real essence, it's not, because everything starts from the mouth, if you consider it that way.
Okay.
Yes.
So what about general health?
So general health is everything. So we have said that the mouth is part of the whole body. So even if we're talking of general health, we're already also talking of the oral health.
Okay.
So there's some conditions like which can be affected if we don't really take care of our oral health.
Okay.
So I'll just mention some
Okay,
of the
yeah.
diseases.
Can you do?
But I don't want to scare people.
No,
But
please do.
it's-
I mean, we are here to learn, and
Yes.
as Christians, relate it to our Christian life, because for Christians, we believe in the mind, the body, and the soul. And the body, I think the teeth is part of the body. So anything that we need to know, because at the end of this, is our belief that we will live here with something substantive when we are talking about our oral or dental care, so that we can practice, or if need be, we can put in place measures to protect our teeth. Yeah.
Yes. I'm so happy that you referred to the Bible in this discussion. And I don't know if I remember very well, Paul talked about the members of the body, and he was using the parts of the body
Okay.
to explain that each member is important.
Yeah.
It's the same also with our health, general health. So even though today we're just discussing about the oral health, there are other body parts that are affected if we don't really take care of our health. For example, for people who suffer from heart diseases, and there's bacteria that can come from the mouth and they can affect the heart valves. So the heart valves are the ones that open and closes when the heart is pumping blood to all the parts of the body. So if those valves are affected, they become inflamed. So we've got a disease that we call endocarditis. It's whereby the bacteria, which will be coming from the mouth, it goes into the heart. So the bacteria enters the bloodstream and then it goes to the heart, and then it affects the lining of the valves of the heart.
Okay.
So when that happens, the inner layer of the valve of the heart, it becomes inflamed. So you end up having endocarditis. And then there are some also patients like who are also suffering from heart disease. They might end up having, if they've got atherosclerosis, which is a heart disease which affects the arteries of the blood.
Okay.
So if they're affected also, they can be the bacteria who cause plaque. So when there's plaque, the plaque will cause also inflammation of the arteries, and then someone can also suffer from a heart attack. So why am I talking about bacteria? So
I was coming to that actually. So yeah, because my belief is I don't know, it's from my outbringing or what. Jesus said that it's not what you take but what comes out.
Yes.
Okay. Yes. In contrast, I believe what you take in is irreversible. Okay. What you take in is irreversible. So you need to be very cautious about the things that you take in as a person. So if you don't take care and you just take anything,
Yes.
the moment it gets into the body, unless its work is being done, you will never see it again.
Yes.
So since the mouth is the gateway to the body,
Yes.
more like it.
Yes.
Yeah, the mouth is the gateway to the body itself. Coming back to the bacteria thing that you are talking about, I think it's very important for us to know the kind of things associated with it, so that we're able to protect ourselves. But I'll beg of you to break it down, because when you go a bit technical, then some of us begins to lose interest in what we are saying, which is much important. So can you break it down for us so that we understand?
Okay, so I'm trying to use layman's terms as
Yes,
much as
exactly.
possible to make it as simple as possible so
Yeah.
that everyone can understand. So for bacteria, we all have bacteria. Everyone has got bacteria. So we've got what we call the normal flora. This is the normal bacteria in the body. So there's a balance of bacteria. There's the good bacteria and the bad bacteria. So there are some factors that can cause like imbalance between the normal bacteria and the bad bacteria. So as I've said, we've got the normal bacteria. This one is normal. It maintains the pH in our body and also in our mouth. We need a certain pH, like acidity and alkalinity in the body.
Okay.
So when we have the normal bacteria, if the other bacteria, the bad bacteria, becomes higher. For example, you haven't brushed your teeth for like days. That's why we brush our teeth every day, because we have to remove that bacteria. That's why we drink water. When we drink water, we also lower the bad bacteria in our mouth.
Okay.
So in the event that we are not taking care of our teeth, the bad bacteria will overcome the what? The good bacteria.
Yeah.
Yes. So if someone has got like bad breath, it's also a sign like the bad bacteria is higher than the good bacteria. So when we have now a lot of bad bacteria in our mouth, that's the one that can go into the different parts of the body. For example, for those, when we breathe, sometimes we breathe in the nose, but sometimes we can breathe with our mouth, right? So in some cases, there was a study that says that when you breathe in like the bad bacteria using your mouth, it can go into the lungs and you can end up suffering from pneumonia. So this is like one of the few studies that we've done.
Okay.
So if we don't really take care of our mouth, you see where we are going. Right now, we've already talked of the heart disease. We've talked about the what? The lung problem, pneumonia. So we can also talk about mothers who are pregnant also.
Yeah.
If the bad bacteria is high in the mouth, it also can affect the baby. And because there's the connection between the mother and the baby, the mother shares the food and also some nutrients. And also the bacteria can be transferred from the mother to the child. And then we end up having things like miscarriages and babies which are born which are not really fit, like low weight babies, which can be born. So those are some of the things that people need to be aware.
Okay.
Yes.
All right. So you've talked about the dangers.
Yes.
All right. So my next question to you is, how do you prevent them?
Okay. So right now, like in this new era, we are trying to do prevention more than curing. Yes, prevention is actually better than when you come and then we have to take out your tooth. So we prefer that you take care of your teeth.
So how do we do that?
They wasting up. Yes, that's a very good question. So we advise everyone to brush their teeth twice a day. So let me break it down to kids, to babies, teens, and then adults. Because if I just generalize it, you might think it's just for the adults. But let me start with the kids.
Yeah, sure.
Okay, so for the infants, the moment that the first tooth comes out, the parents should take care of that first tooth. So they need to brush the teeth twice a day, in the morning and at evening. So the kids, they don't really need to use toothpaste, especially if they are below 2 years.
Okay.
So for kids which are below 2 years, the mother has to really take care of the teeth. They need to really brush. So for let's say for that kid with one tooth, they don't really need to use a toothbrush. So they can use a piece of cloth or a gauze or a bandage, and then they just brush without using toothpaste.
Okay.
And then as the kid gets like 1 year, then they can now start using the toothbrush. And then when the kids are now above 2 years, now they can now use the toothpaste. Why we don't want them to use the toothpaste when they are still young? Because they are not able to spit the toothpaste. So we don't want the kids to be swallowing the toothpaste. And then when the kids are now 2 years to 8 years.
Okay, please let me pause you there.
Yes.
But I've seen a couple of, kids supposedly toothpaste that they use.
Yes.
How? I'm a bit skeptic, because you're saying that you don't, because they can't spit it out.
Yes.
You use cloth and all that. I think
And
water
Yes.
to do it. So why those kiddie toothpaste?
So the kids' toothpaste is for the kids which are above 2 years.
Okay, not babies.
No, not babies.
Okay.
So that kids' toothpaste have got a lower concentration of fluoride.
Okay.
Fluoride is good, but too much of it can also affect the bone.
Yeah.
and the kids are still growing. So if they took too much of the fluoride, it affects the bone, it affects the teeth also. So we don't want them to take too much fluoride.
Okay.
That's why we've got the kid toothpaste.
Okay.
Yes.
So from 2 years, then they can introduce that kiddie.
Yes, that kiddie
Toothpaste.
toothpaste. Yes. And so I want to go back to the kids who are below 2 years.
Sure.
So when the parents, when the kids are being weaned from the breast milk, the parents should not give the kids a bottle of juice to drink while they're sleeping. Because when they've got sugar in their mouth, when they sleep, the teeth, the sugar which is in that drink that they are taking for them to sleep, it will be eaten by the bacteria.
Okay.
The normal bacteria or even the bad bacteria, it can feast on that food in the mouth or that juice that they are drinking, or the sugar which is in the juice. So when the bacteria is that, it produces acid, and the acid would then affect the teeth. That's why you can see some kids when they are very young, their teeth are already decayed.
Yeah.
But the parents will be saying, we clean their teeth twice a day. But they forget that when the kids are sleeping, they sleep drinking something or sucking on something. Or even when the kids cry, we sometimes give them like sweets or candy.
Yeah.
Or we give them like the lollipops.
Yeah.
Most of the time we just say, oh, the kid is crying, or take this, but we don't know about what will happen after. We don't go back to take care of their teeth. So the parents needs to actually to be careful of just giving kids candy. I'm not saying you should not give kids candy. You can give them candy, but make sure at night before they sleep you brush the teeth. And even if they eat things like toffee, which sticks on the tooth, try to remove. Even chocolate, try to brush and then remove that before they sleep. And then for the teens, they need also to, so for the teens and the adult, let me just mix them together because it's almost the same. So we need to be brushing our teeth twice a day. When we are brushing, we need to take 2 minutes when you are brushing. So some people say you can sing the happy birthday song until you finish it, the 3 stanzas. Who is your boyfriend? Who is your girlfriend? May God bless you, whatever. So you sing that happy birthday song when you're brushing your teeth. And also the brushing, you need to brush in the proper way. Some people just brush up and down, left and right.
I can see you have something here. So there's something here. If you can show us. I think our teeth is here. This is not my teeth anyway. This is definitely not my teeth.
Yeah, but they look like your teeth.
This is definitely not mine. So I think Dr. Mundu will show us, since she's showing us how to do it. Your camera is here, you can.
Okay. So the proper way to brush the teeth. Okay. So let's say these are your teeth. This is your toothbrush.
But not mine.
Okay, this is a model of the teeth.
Yeah.
So you put your toothpaste, and then when you brush, we don't advise you to be brushing up and down or like this.
Okay.
So we want you to be brushing in circular motion.
Okay.
So when you brush in circular motion like this, in circles,
Okay.
you go round and round and round and round and round and round, singing your happy birthday song in your mind. And then when you are brushing in circular form, you are massaging the gums.
Okay.
You are also removing the food which is stuck there and it goes down, the one which is up also. So you, in circular form, that's how you do it. But if you do it up and down, you'll be pushing the gums away from the tooth. And most of the people will end up coming with sensitivity.
Okay.
Like I've seen a lot of patients that suffer from sensitivity. And it's because of the way that they brush. They'll say, oh, we brush very well. And their teeth will be nice. They don't have any caries or cavities. But they will be suffering from sensitivity because they would have removed the gums from covering the tooth.
Okay.
So when they brush up and down, they're pushing the gums down, they're pushing the gums up. So that way, they'll end up having that sensitivity when they drink something which is cold. they feel
That sensation.
the sensation. Yes. So we advise you to do in circular motion, and then when you come inside, also on the back of the tooth, I'll try to so that you can see.
Yeah.
So inside also you also do in circular motion, and then when you come at the top of the teeth, that's where you can do like from left to right. So you just go like left to right, even here left to right, also up left to right, left to right, left to right. And then also don't forget to brush your tongue.
Okay.
Yes.
Why?
The tongue also, the bacteria also goes on the tongue.
Okay.
Yes. And it can also smell if there's also bacteria there. So you need also to brush your tongue. So you stick out your tongue and then you brush it out. After that, you rinse and then you spit. About the rinsing, I don't want to get into that. There are some studies that say you should not rinse out the...
Yeah.
And then...
I don't want us to go there.
Yeah, let's not go. That's a debate for another day.
Another day. Yeah, sure.
Yes.
Sure.
So for me right now, just spit. Use the water, you rinse, then you spit.
Okay.
If you don't want to spit, if you are those people who don't spit, then yeah, you do what you do.
Okay. Now, the big question for me
Yes.
is, when do I see a dentist?
Okay. So for seeing the dentist is every 6 months. Not once your lifetime when you have toothache. That's what most of us do.
Do you know that?
Have you been to the dentist before? Okay, guilty. Okay, so when should you be?
So that's why I'm asking that. When should we visit a dentist? Because trust me, I don't know. For Ghana here that we find ourselves, I think going to the dentist is not a popular place of visit.
Mm-hmm.
That's why I'm asking, because we all have faulted, we all have faulted. So when is it appropriate? You are saying that every what?
Every 6 months.
Every 6 months.
So it means twice a year.
Why? Why twice a year?
Okay. So when you come to the dentist and then we clean your teeth, we have what we call plaque. So even when you brush your teeth, just few minutes after you brush your teeth, there is what we call plaque. It's a thin layer of bacteria that sticks on the teeth. So when you brush your teeth, when you move your tongue, you feel the smoothness. Is it true?
Yeah.
So for everyone who's listening, when you wake up in the morning, try to make your tongue go through all your teeth.
Okay.
And then after you brush, so there is a thin layer that sticks on the teeth. So if that thin layer sticks on the teeth, if we don't brush our teeth, it can become hard. So at first you can remove it if you wipe it. So when you use our toothbrush, you can remove it. But with time, it becomes hard. So we've got what you call plaque. When plaque goes there, it's very thick and hard, and you cannot remove it with the toothbrush as much as you try to brush. I don't know if you've seen people with something like green, or sometimes yellowish,
exactly,
and it can become black.
I've seen plenty.
So it starts with plaque, and then it starts with biofilm. The first thing, the layer that I told you, when you wake up, you feel that whitish, and then after some time it becomes plaque. That's the yellowish, and then later on it becomes the greenish, the blackish. That's now something else. Okay, so there's plaque, there's calculus. Also, the second one is calculus. Then the last one is plaque. Plaque is the greenish one.
Okay.
So, those hard substances in the mouth, they need to be removed. If they don't get removed, you end up also having caries. It end up having gum problems. The teeth starts shaking. So you need to visit the dentist. So after 6 months, let's say if you come in, then we clean your teeth, we remove that hard substance. After 6 months, you'll be having a new layer of that. So imagine, let me say you are like 30 years. I'm not saying you're 30 years. So 30 years. So every 6 months of your 30 years, that plaque and calculus has been accumulating. When we clean, how much of that are we going to remove? Can you imagine? So you may not really see it, because for the front teeth, it comes out easily. But inside the teeth, like at the back of the teeth, if we do an examination and then I show you the back of your teeth, you might see a lot of plaque that you can't see like from the front of the teeth. So it's more like a silent killer.
Yeah, it's scary.
And sometimes it goes inside the gums.
I'm getting chills here.
So when
really getting chills here. This is no joke. This is no joke.
It's not a joke. So some people, when they brush their teeth, they bleed because the plaque will be inside the gums. And then when it's inside the gums, the body will sense that there's something wrong. So there is now inflammation of the gums. And then when they brush, that's when there's bleeding that occurs. And the bleeding, it's a sign to show you that there's something which is not supposed to be there.
Okay.
So it needs to be removed.
All right. So now we know that every 6 months we need to go to the dentist. As a personal thing, how do I detect issues when it comes to my teeth?
You've noticed that in most washrooms there is a mirror, which is there. It's not just for the face, but most of us, we think it's just for the face. It's also when you're brushing your teeth to also look, examine. So when you're brushing your teeth, for me, not because I'm a dentist, but I just made it a point when I was young, like when I'm brushing my teeth, I always look on the mirror. I always look at my teeth, like, is everything okay? Look on the tongue. And some of my friends always say you do it too much. But it makes your life easy. If you make it a routine every day, like when you're brushing your teeth every day, you are looking on the mirror. If you see anything unusual, you will know. But if you've never looked at your teeth, you will not know that I'm having a cavity or there's any decay. So when you open your mouth, if you see anything that is black, something dark in the mouth, then you know that something is wrong, because that thing was never there before. So you just need to keep on checking our mouth. And also another issue that I forgot to talk when you're talking about the 6 months routine is these days we've got oral cancer. And oral cancer is a silent killer. Most of the patients that come to the hospitals, they'll be now in stage 4 of the cancer, because when it starts, you don't feel pain, you don't feel anything. It starts very quietly, but when it's now in its severe stages, that's when you start feeling the symptoms. So it's always good to know how your mouth looks like, the same way you know your face. If you see a pimple like there, you will know like, oh, there's something wrong. This was not there. Or if you see a blister, you will know like this was not there. So also with our mouth, we need to know. And even when you are eating, when you are drinking, you need to notice, like if I take something which is cold, I feel sensitivity, I feel pain. For how long? So you need to know all those things.
Okay.
The same way with kids. Like kids, I like babies or the infants. When they are eating, if they feel like something is not okay, they'll tell their mother. They'll just say ouch, or what do they call it in She? I forgot.
Don't worry, ouch is okay.
Yeah, but the kids will actually tell the parents like, I feel something. But for us adults, we might just think like, oh, it's something minor.
Okay.
And the next thing, you chew bone and then the tooth breaks into pieces. But you might have felt something like previous weeks, but you actually didn't think that it's very important. So as much as we take care of anything else, it's also important to take care of our teeth and always look on the mirror. Just check. If you can't do it every day, maybe once a week. And also in some patients, we advise, in most of our patients actually, we advise that you floss every day. So when you're flossing, after you brush your teeth every night, you need to floss. When you're flossing, you'll notice that something is wrong.
Nice. Okay. All right. So This whole teeth whitening thing, I mean, I don't get it. Because people have the belief that
If you have white teeth,
that means you have healthy teeth.
Yes.
So, Dr. Munde, you are an expert. What's this whole whitening teeth all about?
So if you said it's a misconception, it is actually a misconception. And for teeth whitening, what I always tell my patients before I do it, I always tell them, like, your tooth color usually looks the same with the color of your eyes.
Okay.
So if you look on the mirror and then your teeth are not very white and your eyes are not that white, then that's your color. That's it. You don't need anything more. And as we grow older also, the color of our teeth changes due to the food that we eat. So the color that it's a little bit off-white, there's nothing wrong, but people want to have those white teeth that they see on the television. So for teeth whitening, it's more like bleaching of the skin.
Okay.
So the same way that, yes, we like yellow bones, is the same way that people like white teeth.
Okay.
So when we are doing the teeth whitening, we actually use bleaching agents like hydrogen peroxide. So what it does is it removes the outer layer of the tooth, the enamel, which is actually the covering of the tooth. So the more, when we do that, we do in sessions. So like 15 sessions, we put our hydrogen peroxide, we put the curing light there for 15 minutes. And then the more we keep on doing that, so some patients can come and say, I want my teeth to be very white. So we do like the first session, probably the second session. Sometimes when you reach like the third and fourth session, the patient will be feeling sensitivity. Some people can actually say beauty is pain. So I want my teeth to be very white, but it's a misconception. And for me, I don't actually like doing whitening unless if a patient like really convinces me, because I would be feeling the pain, like I'm removing the layer of the tooth which is supposed to be protecting you.
Yeah.
Yes. So whitening was supposed to be done only for teeth that we call them non-vital.
Okay.
Like teeth that are dead.
Okay.
But we have kept them because we've done like what you call root canal treatment. We've treated them, but then they change the color. Then we do what we call like non-vital bleaching. But later on, because of commercials like the television and then the celebrities, they're the ones who come and then they put pressure. So it's more like a peer pressure. So I wouldn't really advise like someone to do whitening unless if it's necessary. It doesn't mean that your teeth are healthy when you do whitening. It's actually about the condition of your gums and also the condition of your teeth. If your teeth have got the outer layer which is protecting it, it's in good condition. You don't need that whitening.
Sure. Okay. So we've talked about so many things. Now, one thing that I left out is what we are taking in. So, in your expert's advice, what kind of food or fruits, things that we need to be mindful when taking in that can damage our teeth? We
have got the high sugar food, which have high content of sugar. So if you take that, the bacteria that is in the mouth, it feasts on sugar. So if there is sugar which is in the mouth, then it feasts on that, then it produces the acids. But also it depends also with the amount of time that sugar will stay in the mouth. So you can take your sugar and then you drink water or you clean your mouth after, and there's no sugar in the mouth.
Okay.
Then you are good to go. Your mouth is clean, the bacteria doesn't have anything. So it's not just about the food that you eat. It's about the amount that the time that the food stays in the mouth after you've eaten it.
So I can eat it. I can just eat anything.
Yes, you could eat anything. And another thing is the frequency of intake of sugar. Or of the food that we are talking about. So there's someone who can eat like 3 meals a day. And then when they eat their breakfast, there's a lot of sugar. Their lunch, a lot of sugar. Supper, a lot of sugar. Or carbohydrates, which is which are sugars.
Yeah,
So
sure.
yeah. So that person is taking different 3 meals, 3 normal meals. Then there's someone who snacks a lot.
Yeah.
Every hour they're just chewing. They're just eating something. They've eaten polo, they've eaten this, they're drinking malt. You see, they're just eating something. Every hour you're just chewing.
I think some of us are taking stray bullets here, but we're not going to comment on it.
So as much as I would want to do like don't eat this food, it's about what is left in the mouth when you eat. So is the frequency of sugar intake. And if you take the sugar or a lot of carbohydrates, then you just need to clean your mouth. Then you are fine.
Okay. So my final 2 questions, then we can bring this segment to end. I don't want us to eat much into it. We will schedule for another session that will go much deeper into it. What are some of the misconceptions? We've talked about one, but in your field, you come across many misconceptions when it comes to dental care. Can you share some with us?
Yes. One of the misconception is people think that there is a worm or a bacteria that causes tooth decay. So they'll come and say, oh, doc, can you remove this tooth? It's painful. I don't want the bacteria to jump from one tooth to the other.
Okay.
And they might even tell you like, oh, my uncle lost like 4 teeth because of this. So I also don't want to lose. Or the person might have also lost one tooth from extraction. Then they'll also say, oh, now the next tooth is being affected. So please take this one out. Even before it's badly broken, they'll come and they'll push you like, please remove this tooth from me. Because that bacteria or the germs or the worm will jump. But there's no worm. And sometimes because of the pain that they feel when they're having toothache, the pain, it feels like there is a worm which is moving.
That sensation.
So it's actually the blood nerves, which are what? The nerves which are pumping.
Yeah, okay.
Which are moving, like the sensation which is moving through the nerves.
Okay.
So it feels like
something,
yeah,
like a worm.
It's a worm.
Yeah, okay.
Yes, but there is no worm which is there.
Okay.
So people should know that if the tooth is decayed, as soon as they see like the black coloring that doesn't come out with toothbrushing, they need to see the dentist. Then we do fillings.
Okay.
And some have got the misconception that if you do a filling, it is going to fall, that tooth is going to become painful with time. It depends, like with the time. You need to do perfect timing when you are doing the filling. If you come when the tooth is already painful and badly broken, then someone who comes with the tooth which is just starting to be decayed. Those are 2 different situations. So the earlier the better.
Okay.
So the earlier you come in to save. Another misconception.
Yeah, add the last word to it.
Yes. Okay, so another conception is people believe that you can remove the caries using toothpaste, using some herbs. You can cure the tooth using herbs.
Okay.
So if you've used the toothbrush and it's not working, and you see anything which is hard and you can't remove it with anything that you usually use for cleaning the teeth, the only thing is to visit a dentist. So some people can post on Facebook and say when they'll be having calculus or plaque on their teeth, like that brown substance that I was talking about, the greenish, they'll take a picture and post and say, oh, I've got this, which toothpaste should I use? I've been using Pepsodent. And then those people who sell toothpaste, the different types of toothpaste, they say, oh, try the aloe vera one, try the charcoal one. And people will buy.
Yeah.
And those toothpaste, they're actually expensive than Pepsodent.
Yeah, very.
You buy, but it won't help. Another thing is people just put herbs. When they're feeling pain, they put herbs inside. Some put Dettol, some put battery acid. People do crazy things. You don't know. People put crazy things. Some people can chew certain leaves, then they put there.
Wow.
Yes. And most of the time when they come to the hospitals, they will be having an abscess or the pain. They may even tell you like, oh, before this was working. At first it will work. It's more like a placebo effect. It will work. But with time, because if that bacteria is still there, you are just pressing it down. You might kill the surface bacteria, then the tooth becomes quiet. But with time, you might end up having like someone who come with big abscess with caca, which is there,
Okay.
with pus, which will be there.
All right.
So those are some of the myths.
Misconception. Okay. All right. So, Dr. Monday, you advise to all of us why we need dental care.
We need dental care so that we keep our teeth. We don't want you to be losing your teeth. So try by all means visit the dentist at least twice or once a year or every 6 months if you.
People are thinking about the money.
Yeah, I know people think about the money, but one thing I've noticed is here in Ghana, there are a lot of like outreach programs that are done in almost many churches.
Yeah.
That's one thing I appreciate about this country.
Yeah.
They do outreach program, and then when we are doing outreach programs for especially in churches,
Yeah.
they do like mouth free screening. So if you hear that there's a free screening, at least
Try and partake.
try to partake on that. It's free.
Sure.
It's just your time. Go for
Yeah,
the
sure.
free screening.
Yeah.
And then from there, you can actually save money. Like most of the procedures, they're not so expensive. Some of us can buy like makeup. We can buy like a nice wig, which is costing like 200 cedis or even more than that. But you can't even use 200 cedis just to get your teeth cleaned. And some can buy nice suits. We can buy like how many plates of fufu. You see,
I think
it's all about prioritizing.
I think people are taking straight bullets here.
So if you plan to say, okay, 6 months, in 6 months, let's say cleaning it's 350 cedis. This is just an estimate. It's
Sure.
350 cedis.
Yeah.
Are you not able to raise 350 cedis in 6 months? Oh, it's once a year. So prevention is actually better than cure.
All right. In the mortal words of Dr. Patience Mundi, prevention is better than cure. There we have it. I think we've learned a lot today, and I appreciate you coming. Although I've taken a lot of stray bullets here, but
It was not meant for you.
because the mention of polo and all that, well, I don't know. All the same. So there you have it. We need to take care of our dental care. I mean, we need a good smile just to, brings our spirit back to us. And if you can't smile, that means you have to frown, and you frowning, at least you dampen the spirit. And Dr. Mundi, we thank you very much for sharing your knowledge with us. And we know we will start visiting the dentist and also get our teeth and our oral hygiene properly in function. All right. Thanks for being with us today. I hope you've enjoyed the program. Dr. Patience, give me some blues here. All right. Thanks for being with us. God bless you. See you in the next episode. Shalom.
Thank you.